Microscopic World. Discovered with Goko Japan.
Greetings from Goko Japan. In this video, we explore quite an interesting research using the capillaroscope Goko B-Scan series, focusing on plastic surgery. We will now continue by introducing case studies presented by Dr. Kento Yamamoto from the Department of Plastic Surgery at Aichi Medical University Hospital. Dr. Yamamoto is recognized for his expertise and potential in plastic surgery. He's been utilizing Goko's capillaroscope since its early stages, applying it to a diverse range of cases, including skin flaps, laser treatments, burns, pressure ulcers, among others. The paper, contributed by Dr. Yamamoto to the Japanese Journal of Plastic Surgery, highlights the broad potential of utilizing capillaroscopy in the fields of microsurgery and plastic surgery. This paper clearly presents the research results on the capillaries of capillary malformations, burns, and pressure ulcers using the Goko capillaroscope, along with case studies in microsurgery. The Goko capillaroscope allows for magnified observation of capillary shape and flow, simply by placing the scope on the body surface. It offers numerous advantages, including simplicity, non-invasiveness, and the ability to provide objective evaluation through visual inspection. First, let me introduce an example of a magnified view of the capillaries in capillary malformation. Dr. Yamamoto conducted a magnified observation of a capillary malformation of the palm of a 4-year-old girl and compared it with a healthy area. In the healthy area, the capillaries are neatly arranged in loop patterns that align with the skin ridges. However, in the affected area, the capillaries are disorganized, with individual vessels appearing swollen and dilated. This is considered to be the first report of a magnified observation of capillary malformations with actual blood flow visible. Additionally, the paper presents findings where the same area was observed under magnification after laser irradiation, showing that the capillaries had reacted to the laser by becoming charred and the blood flow within them had ceased. The study suggests that the capillaroscope could be applied to various research areas, such as investigating the effects of laser irradiation on capillaries. Next, let me introduce an example of a magnified view of the capillaries in burns. The paper presents examples of magnified observation of 3 different areas on the 9th day after a burn injury. Number 1. An area suspected to be SDB, superficial dermal burn, partial thickness burn. Number 2. An area suspected to be DDB, deep dermal burn, deep partial thickness burn. Number 3. An area where it was unclear whether it was SDB or DDB. In area 1, which was suspected to be an SDB, the capillaries were dense and well developed. As predicted, this area was confirmed to be SDB, as it was almost completely epithelialized by the 14th day. In area 2, which was suspected to be a DDB, necrotic tissue was present, and no capillaries were observed under the capillaroscope. It took 45 days for epithelialization, confirming that it was indeed a DDB as expected. In area 3, where it was unclear whether it was SDB or DDB prior to capillary observation, magnified observation with the capillaroscope revealed the presence of capillaries. This area also epithelialized by the 14th day, indicating that it was an SDB. This paper suggests that even in areas where it is difficult to confidently determine whether they are SDBs or DDBs, using a capillaroscope to observe the area around 7 days after the injury may enable the distinction between SDBs and DDBs and potentially predict the time required for epithelialization. Finally, let me introduce an example of a magnified view of the capillaries in pressure ulcers. The paper presents an observation case of a pressure ulcer in an 88-year-old bedridden female who is being cared for at home. The observed area was rich in blood flow, but the moment when the blood flow ceased due to slight pressure was captured. This observation is anticipated to be one of the important findings in future research on pressure ulcers. We express our respect for Dr. Yamamoto's insightful observations. Thank you for watching. Now it's your turn. Please join us today and take advantage of GoCo's capillaroscope.